The reason why you have all this knee pain is because you've lost all the cartilage in your knee. That cushion is worn away and now the bones are rubbing together, and that's a very painful condition. And since we have already tried multiple conservative treatments such as medications, maybe injections, bracing, or physical therapy, and now that none of those simpler treatment options are working for you no longer, now we have talked to you about performing a total knee replacement, which many people have the misconception that we actually remove a very large section of your knee, but in reality, we just resurface the ends of those bad bones, replacing the bad cushion and the bad ends of the bones with new metal and plastic surfaces that then you can walk on pain-free. After you have a knee replacement, the typical recovery, if you ask most patients a year later, they have the opinion that it took about 3 months for them to recover. Most of that recovery is in the first 6 weeks, and most orthopedic surgeons, including myself, would have the opinion that it really takes a whole year to get as good as you're going to recover from a total knee replacement. And some total knees will even improve for beyond a year